Hello, my name is Bajai Yang from section 81034, and I will be doing my presentation on Candida albicans. So Candida albicans is a fungus that belongs in the family Saccharomycetaceae. It is an Ascomycota, which is the largest phylum of fungi. This organism is a small oval cell that measures from 2 to 4 nanometers in diameter. And then it has 3 morphologies. The yeast cell stage, which is the first picture right here, and then the pseudo-hyphae, which is the second one, and then the true hyphae form. The second picture, you could already see that it's forming a germ tube. Genetic nuance of Candida albicans. It is the most prevalent microbe of the microflora. During the yeast cell stage, the organism is a white bud, and it will adhere to a substrate to form a yeast basal layer. And then yeast cells will propagate and form germ tubes. It can form a biofilm, which is why the organism can become resistant to antifungals. During the hyphae form, makes the organism virulent. This phase, the organism is opaque, and an extracellular matrix accumulates when the cells are matured. And this is the formation of biofilms, and seeds will disperse from the biofilm to colonize other areas. Microbial physiology. Candida albicans is a heterotrophic fungus. It reproduces asexually and sexually. Isolated haploid of Candida albicans can mate together to generate diploid strains. During the white cell phase, the organism is round, forming dome-shaped colonies. Mating during this phase had low efficiency rates in vitro and in vivo. The opaque form, the organism is elongated and have flatter colonies. Mating between opaque cell is 1,000,000 times more efficient than the white cell stage. During diploid stage, the white cells will form homozygous white cells. Reservoir and environment. The organism can survive in environments with variant pH. The vagina is an acidic environment, but Candida albicans will remodel their cell walls to enhance chitin and beta-glucan. It also resides in the stomach and in the GI tract. Pathogenicity. Candida albicans is a commensal organism and also an opportunistic pathogen. Sometimes when the human microflora is lacking in the bacteria Lactobacillus, Candida albicans will flourish and cause an infection. Candida albicans become pathogenic under these circumstances. If a person is taking antibiotics, if they are elderly, or if there is a hormone imbalance. So 75% of women will experience vulvovaginal candidiasis once in their lifetime. So that is a yeast infection of the vaginal mucosal wall. Infectivity. Candida albicans infection is one of the most common causes of hospital-acquired infections. The central venous catheter often becomes contaminated with the organism from the patient's skin or the healthcare team. It leads to biofilm buildup within the catheter. The organism is transmitted from mother to infant through childbirth, and it becomes a part of the baby's microflora. And then sometimes baby will develop oral thrush from breastfeeding, and that is because Candida albicans live on mother skin. And to the right is a picture of oral thrush on a baby's tongue, and it is has white residue on the tongue. Candida infection can spread through sexual contact with a person that has a yeast infection. Candidemia is an invasive infection mostly caused by Candida albicans. So the proportion of infection between species does vary by geographic location and patient population. And then in hospital, all-cause mortality among patients with candidemia was 25%. But the death rate due to the cause of the infection is still uncertain because most patients with candidemia already have an underlying condition, so the mortality rate was considered inaccurate. Candida albicans can recognize the host biomolecule in which it can adhere to it. It can transition to different stages and also reverse transition. Descriptive epidemiology. A reason why cases of candidemia are decreasing is because of improved delivery of hospital equipment and maintenance. Some surveillance areas show increased cases of candidemia, and those areas had a lot of injection drug use. Incidents of candidemia in infants have decreased significantly, but it's still highest among any other groups because practice of infection control and fluconazole prophylaxis is high risk. Preterm babies assisted the decline of candidemia rates within infants. And then 65 years and older, they still remain as one of the most frequent group of having candidemia. And then candidemia rates are doubled in African Americans than any other race in the United States, probably due to different underlying conditions, socioeconomic status, or other factors. Analytic epidemiology. Risk factors for Candida albicans infections are recent antibiotic use that can clear the human's microflora of good bacteria, leaving the fungi to thrive. Pregnancy that increases estrogen, which will throw off the balance of yeast and bacteria in the vagina, causing yeast infection. And then people with underlying conditions like uncontrolled diabetes, that can lead to frequent yeast infections. Cancer patients that had chemotherapy are susceptible to fungal infections because of the innate immune cells, and epithelial barriers are weakened. Signs and symptoms. Vulvovaginal candidiasis is a rash. People will experience itchiness in the genitalia and have white discharge, a pelvic exam, and take a sample from, a doctor will do a pelvic exam and take a sample from the discharge from the vagina for diagnosis. And then oropharyngeal candidiasis is an overgrowth of yeast cells on the tongue, palate, uvula, or the buccal mucosa. Symptoms are burning, pain, and change of taste. For diagnosis, a doctor will scrape the infected area in the mouth to examine it under the microscope. And then candidemia, it's a systemic infection. It can affect the heart, blood, eyes, bones, and other part of the body. When it invades the bloodstream, it can cause septic shock, and symptoms would be low blood pressure, fast heart rate, and rapid breathing. And then to diagnose that, they would do a candida antibody test, and it will look to see if there are elevated antibodies of IgG, IgA, and IgM. Treatment and management, vulvovaginal candidiasis will be a short course of topical formulation. Usually topical azole drugs are the primary treatment. And for oropharyngeal candidiasis, it'll be an oral fluconazole. And for babies, they usually prescribe nystatin mouthwash. And then for candidemia, echinocandins are given intravenously. And at last, control and prevention. Use of antibiotics only as the doctor directs. Person should always keep their skin clean and dry, and person should have a healthy lifestyle and proper nutrition. Okay, thank you.